We have this session and one more session, and then we'll be lunchtime. My name is Dean Andersen. Again, I'm the grant coordinator for the State Traumatic Brain Injury Grant. We're operated out of the University of Kansas City Institute for Human Development. I'm lucky I get to work with Dr. George Gatto and Kelli Barton, who really did the number crunching for this next presentation. And Kelly's standing right here, and she's going to be the other speaker. At your table, you should have one of these little forms. It's the bingo form. It looks kind of like this. And if you've been at any of these sessions in the past, you've seen these forms. This will be the third year in a row that we've used these forms. These forms are kind of providing us with a snapshot of where you all are at with your processes at your institutions for implementing protocol around TBI. So if we want to change to the next slide, that'd be good. Is that, oh, it's right here. Okay. Cool. All right. All right. So on this bingo form, you'll see that there's a bunch of different little squares. Each one of them asks questions about where you're at with your protocol. At the bottom of each square, there's 1, 2, 3, and 4. If you never do what the question is asking, you would actually answer no. If you do it somewhere between 1% and 25% of the time, then it would be number 1. If you do it somewhere between 25 and 49% of the time, it'd be 2, and then 3 would be 50 to 75, and then 75 to 100 would be 4. And if you do it all the time, then it would be number 5. So it's kind of like a Likert scale. But that's kind of how the thing works. And so the data that we've been getting back for the last couple of years will be reflective of this scale. And again, here's what the form looks like. So we utilize this really to get the feedback to kind of get a little snapshot of where folks are at. There's 24 questions, and we kind of put it in this form. We really had help from the Missouri Association for State High School, the Missouri State High School Association for Athletics, and they really helped put this thing together. And so that's what it looks like. This is one of the first snapshots on the demographics. In the table, you can see that there's quite a bit of discrepancy in the turn-in rates between cities. Columbia actually had one of the highest turn-in rates with a turn-in rate of about 46%, and Cape Girardeau had one of the lower turn-in rates with 18%. So St. Louis was somewhere in the middle. But this is your opportunity actually maybe to get ahead next year. If you want to fill them out today, it could put you in the lead. So we hope that maybe you'll consider getting these filled out. I'm going to let Kelly really talk about some of the more intricate results associated with the study, and leave it with that.
And you can see at the bottom of this slide, this is the primary role of those who responded. So you can just see, the greatest response rate was from coaches, followed by nurses, et cetera. So just to kind of give you an idea of who is filling this out and who these responses are representative of. So we've done this for the past 2 years, 2016 and 2017. So this is kind of a broad view of what we're seeing. So if you look at the far right, that's the overall average. And again, so 0 is not doing this policy or practice at all, and 5 is doing it all the time. So we see the overall average throughout the state's 3.8 in both 2016 and 2017. So we're remaining pretty stable on that. But when we start to look at the regional numbers, we start to see a little bit of variation. So in Columbia, we do see the highest rate of, or highest frequency of doing some of these policies and practices. So the average is around 4, which is between 75 and 100% of the time implementing these policies and practices. But we didn't see any statistical significance in any of these differences, so it's remaining pretty stable, which, for 1 year's time is pretty typical. As we all know, the uptake of policies and practices and changes takes time. So, and then we looked at each of the items specifically on the concussion bingo form, And we see that the one that's being done the most frequent is the physical examination form, so probably not surprising to any of you. That's pretty standard. So that's almost 100% of the time. And these are the 2017 numbers, so numbers from last year, all the way down to an ambulance at all contests. So that was at 2.6, so less than 50% of the time being implemented. And then you can kind of see those in between, and we'll talk about some of those a little bit more and the changes. So the next two tables show the changes from 2016 to 2017. And you'll see on the far right, that's the mean change from 2016 to 2017. And if they have the little asterisks next to them, that's a statistically significant change. And so we're not seeing a huge change, and we're also not seeing a lot of statistical significance, which, as I said, makes sense. It's only been a year. But we do see, so one of them that actually decreased from 2016 to 2017 is having a certified athletic trainer part-time. That decreased in frequency, and that could be, we also have full-time, you'll see up at the top. So it could be that schools or organizations are transitioning from part-time to full-time, or it could be a budgetary issue where both are actually getting decreased. And so, as we continue to collect data over the years, we'll start to see a clearer picture of why this is happening. And then we see administrative meeting and education related to traumatic brain injury. So that actually increased from 2016 to 2017. So that's moving in a promising direction. This is a continuation of that table. And again, we see not many of them are statistically significant, but we do see emergency action plan practice increased from 2016 to 2017. And we saw the pre-participation physical education form actually decrease. And again, we will run all of these results by, we have a panel of experts that we periodically meet with to talk about kind of what these findings mean and where we should be moving next in our grant activities. So this is something that we'll be kind of digging into, especially after we get this year's data. So what we also did is looked at this data by region to start to really dig into what are the differences around the state, or are there any differences? And so I just broke it down to only those policies or practices that had a significant change. And so you'll see on the left a significant increase in frequency of that policy or practice. And on the right, you'll see those that had a significant decrease. And I'll just say the decrease doesn't mean bad necessarily, so it's not a good and a bad list or anything like that. Some of them, like certified athletic trainer, is on the bingo board as part-time and full-time, so maybe part-time decreased and full-time is on the way up, or again, it could be a budgetary issue where both are going down. So we see in Cape Girardeau having a full-time certified athletic trainer, having a team doctor, and having an ambulance at all contests. All of those significantly increased in frequency from 2016 to 2017 in the Cape area. Columbia didn't have any that significantly increased, but there were two that decreased, so having an ambulance at some contests and then part-time athletic trainer. And I will say, once we start to break these down by region, the sample size gets smaller, and so there may be other policies or practices that are kind of on their way to significance, but the sample size really wasn't robust enough to show us some statistical significance. So having your responses this year and having another data point to really kind of give us a stronger picture of what's happening is really important. So we really do appreciate when you guys fill these things out. In Kansas City, the having an administrative meeting, meeting and education related to TBI, that increased, as well as school board meeting and education and safety equipment checks. And they had a pre-participation physical examination form decrease. In Springfield, we saw 3 of the policies frequency decrease: athletic trainer full-time and part-time. So that may be one of those areas where it is a budgetary issue, as well as we saw a decrease in baseline testing. So we're interested to get the data this year and really dig into seeing whether that trend continues or what that looks like. And then finally here in the St. Louis region, we saw an increase in emergency action plan practice and decrease in athletic trainer part-time and school board meeting and education. So we're interested to see kind of where those head in the next year. And so just kind of a summary of these. We did see some statistically significant increase in 2 of the policy or practice items between 2016 and 2017, where the ratings indicate greater frequency of implementation. And so those were administrative meeting and education related to TBI and emergency action plan practice. So, hopefully the efforts that Dean's group has been doing, as well as some of your other organizations, are contributing to that. And we also see the changes regionally. So increase in several policies, as well as decrease in frequency of several policies and practices. So, we hope to kind of really dig into those in the next round of data. And so kind of what's the point? Why are we doing this? Well, like I said, we'll do 2018 data, and we hope to compare these results, 2016, 2017, 2018, and really start to draft a plan for Missouri and guiding initiatives as we move forward and how we're addressing TBI, and hopefully, really elevate our state activities to the next level. And also the grant that Dean and I have been working on for the last 5 years, or 5 years, is that right? 4 years, 4 years, going on 5 years, will be ending. And so we really hope to, continue to get grant funding to work on some of these initiatives. So having this data really helps guide a lot of our activities and hopefully guide where we're targeting our next grant that we get, hopefully. Thank you.
Were there questions? I think it's all, yeah.
We'd like to parse it out and be more, we'd like to parse it out and be more specific, but we didn't want a million items on a bingo form. The fewer the items, the more likely we are to actually get them filled out and get them back. So.
All right. Well, I'd like to thank you for coming and presenting on this. Our next presenter then is going to be Greg Stahl. He's the Executive Director of the Missouri State High School Athletic Association. So if you give him a nice little warm round of applause.
Good morning, everyone. Good to be with you today. This is, our association, State Athletic Association, continues to be in good partnership and support with the BIAMO, and look forward to continue to do so. All the statewide locations, this portion of the presentation is really supposed to be myself and a gentleman named Harvey Richards. Many of you may know Harvey. He's presented in the past. He's now retired from our office, but he is still a co-chair on the Sports Medicine Advisory Committee and was appointed 2 years ago to the Brain Injury Advisory Council for the state of Missouri. Harvey is not with us today, so I'm flying solo. We have to feel sorry for Harvey picking up his golf game in California for a little 6-day vacation. But again, good to be with you. My name is Greg Stahl. I'm with the MISHA office, Assistant Executive Director. I'm actually in my 2nd year of overseeing or working with, if you will, our Sports Medicine Advisory Committee. Dr. Mark Halstead, who just spoke in the previous presentation, is on that SMAC committee for us. We are very lucky to have his knowledge and skills on that committee as we move forward dealing with concussions and head injuries. Next slide, please. Or do I have one here? Where's my? Oh, wrong button. There we go. So first of all, just a little bit of history about the MSHA head injury survey. Actually, the official name of this is kind of wordy, but it's actually officially referred to as the Interscholastic Youth Sports Brain Injury Report. It is an annual report that we put together and have to provide to the state capitol. And the reason for that is in 2011, House Bill 300 became a state law in Missouri. And essentially, in short, that bill basically mandates that any organization that has public schools as members are required to publish and distribute an annual report regarding the impact of student concussions and head injuries. So since 2011, we've been producing this annual report, posting it to the sports medicine page on our website for anyone of the general public to be able to view. Although its main focus is on concussions and head injuries, we do use it as an opportunity to reach out and ask a series of several other questions not related to concussions and head injuries, but other questions related to the presence of AEDs in our schools, the presence of emergency action plans in our schools, the presence of EMT or ambulance services at contests. Good question earlier by the young lady back here at the table about presence of ambulances at all contests. We have come to find that, I would say probably because of availability, ambulance services are most commonly found at varsity level contests, and varsity level contests that are more prominent for collision occurrences, if you will. So there's a little bit of information in our brain injury report posted to our website regarding the ambulances being available at contests. Also want to talk a little bit the history, as far as the history goes. In 2011, when House Bill 300 came out, we as an organization, MSHA, decided that we needed some help here. So here we have this House bill requiring us to do an annual report. We need to tap into some professionals, get some knowledge, get a track that we can follow, if you will. So basically, we joined together with representatives from the Department of Health and Senior Services, the Missouri School Board Association, our office, the Brain Injury Association of Missouri. We developed guidelines, pertinent information, and forms to help educate our coaches and staff at our schools, as well as our athletes and parents and guardians regarding the nature and risk of concussions and brain injuries as it relates to playing sports. So basically right now, just real quick before I go any further, how many are in attendance today that work directly for or with a MSHA member school? Raise your hand. Good, awesome. So of that number, how many of you are coaches? Outstanding. I want to take a minute to thank the coaches for having the interest in being here today, because a lot of times their plates are full and it's hard to get them to these kind of educational settings to really bring this topic to their attention. How many school administrators with our schools and athletic trainers that serve directly with our schools? Excellent. So moving forward, I want to make sure to remind everyone in the room that there is a MSHA bylaw in place as related to House Bill 300 here a little bit, but there is a MSHA bylaw in place, bylaw meaning rule, that mandates that our member schools provide concussion education to coaches and to parents on an annual basis. So just as a reminder to those school personnel here in the room, that is a mandate annually. So let's talk a little bit about the head injury survey details. I'm not going to have time to get into real depth here from a data perspective. I do have one slide that I want to share that does a state comparison with the national rate of concussions per athletic exposures. But just real quick, focusing on head injuries and concussions. How is the data collected by our office in this interscholastic youth head injury report? We actually use an intranet site to build the survey on, and then what we do is we take a link, we develop a link that gives direct access to that survey. That link is actually emailed out to all of our athletic directors, as well as school nurses and athletic trainers that may be posted on a school's admin page. So let me explain that a little bit, because this is a new feature. That way our people in the room understand what I mean by that. When you go to the Misha website, administrator, coach, and log on to what we call your school page, the athletic director has access to what's called an administrator's page. If you go to your administrator's page and go to Add Employee, you'll now notice that you have the ability to add your athletic trainer and your school nurse to that admin page. Why? We added that there so that we send out a lot of email broadcasts, if you will, throughout the school year, related to all different kinds of topics. But the reason we wanted the school nurse and the athletic trainer to be added to the administrator's page so that they had access of receiving an email blast from our office reminding them, here's the link to the head injury survey, because we have found that more than likely that athletic trainers, for those schools that have athletic trainers, are the main force behind completing the survey. And we have found in our schools that don't have athletic trainers that school nurses are heavily involved with completing that head injury survey on behalf of the school. So if you are a school that has an athletic trainer and or a school nurse, I'd encourage you to add them to your administrator page so they have the ability to receive that direct email with the link to our head injury survey. The head injury survey since 2011 has been opening in May and closing at the end of June. We're currently in the middle of some discussions on changing that a little bit, okay? We're considering, number one, how to move away from the intranet website that we use through the link that's emailed to you, and we're trying to figure out a way to bring that survey over to our livemisha.org website where it can be accessed by a login and a password. We want to be able to do that because we feel like that would give us an opportunity to complete this survey actually 3 times a year. At the end of the fall sports season, at the end of the winter sports season, and at the end of the spring sports season. I started pushing for this because in the 2 years that I've had sports medicine at our office, I've noticed that my push is to get 100% participation from our schools, which we're not there. There is not currently a fine or a fine structure in place that dings a school for not completing it, and we feel there's actually schools out there that don't have anything to report. For those of you in the St. Louis area, I'll remind you that we have a number of schools out there that have 20 kids in their high school. 20. So there's a pretty good chance they can go through a school year without a concussion. Okay? So that's really why there's not a fine structure in place right now. But I do want you back to the 3 times a year. We feel like if we did that at the end of the fall, winter, and spring season, that information would be more fresh in hand, tracked, documented, etc. What it's not going to help, I'm afraid, is at the end of our spring season. When we currently do the survey right now in May and June, we feel like some of our lack of participation has to do with the turnover at the end of the school year right there of athletic directors, even trainers at times, just school personnel in general, moving on, taking new jobs. They were there during the school year to account for the concussions and head injuries, but then they're gone by the time it comes to complete the survey. So just some thoughts there about where we're headed with the details of the survey. Let me take a step back a minute. So basically, right now, the last 2 years, the survey itself has been issued to 2 different membership types. We have 3 total membership types of schools in our association: a 7th and 8th grade member school, a 7th through 12th grade member school, and a 9th through 12th grade member school. Right now, we are surveying the 7 through 12 and the 9 through 12 in an effort to try to more specifically account for the high school occurrences, because that is, without question, where the majority of these issues are lying right now. As noted earlier, we do ask several types of questions on our head injury survey related to AEDs, emergency action plans, etc. What we did do differently this past year, this past June, accounting for the 2016-17 school year. In the past, all we've asked our member schools to do is report the total count, or number of students, if you will, that was removed from a practice or a contest simply because there were signs or symptoms of a concussion present. This year, we required them to provide 2 pieces of data. One, how many kids did you remove from practice or competition because they exhibited signs and symptoms? The second part of that question was, how many of those students were actually diagnosed with a concussion? Here's where it gets interesting. This might be a neat number for you to jot down and share with your peers. So last school year, there were 2,968 student athletes removed for a suspected concussion. Okay? Of that 2,968, there was actually 2,777 student athletes that were diagnosed with a concussion through the use of the return to play form. So that's a difference of 191. There's a reason why we asked this question in 2 parts, because I kind of wanted to lead it to a train of thought, if you will. So basically, we have 191 student athletes that were taken out of a competition or a practice, but were not diagnosed with a concussion. That's 191 times we had either a coach or an athletic trainer err on the side of safety, is what that number represents, and withholding that student until they are cleared by a physician. The return to play form, I know this is really small, but for those of you in the room, the Mission Return to Play form is a mandatory form that must be completed for any student that's been removed from practice or competition due to signs or symptoms of a concussion. That's located on our sports medicine page. The link there to the right, you can take that link, put it in your browser, go directly to the Return to Play form. One thing that I would like to point out is down here at the bottom, you can't, I don't know that, right down here at the bottom, basically it defines the physicians who are able to complete this form. This is being debated a little bit right now, but as we speak, MD, DO, PAC, LAT, ARNP, and neuropsychologist are the physicians that can complete this form. Head injury data, just talk real quick. I need to move along. But the top chart represents the national rate for concussions per 10,000 athletic exposures. I secured this data from the NFHS, which is the National Federation of High Schools. They are a national governing body for high school sports. They do a significant amount of data tracking with relation to athletic injuries, not just concussions and head injuries, but about anything you can think of, they're researching it. taking a look at this chart on the bottom, here's the state of Missouri, or the MSHA concussion rates per 10,000 athletic exposures. Now notice that I've got a rate 1 and a rate 2. Rate 1 represents the rate of student athletes removed from participation due to suspected head injury, and then the rate 2, what we were just talking about, and the rate 2, the rate of students per 10,000 that was actually diagnosed with a concussion. So in comparing those two charts, it's nice to be able to report that in comparison to the national average, you'll notice that in Missouri, the sport of football, girls soccer, boys basketball, and cheerleading are below that of the national average, with a couple of others actually being a little bit higher. Wrestling in our state, a little bit higher than the national average. I think it's interesting. I don't ever expect football to not be the highest rate, obviously because it's a full contact collision sport. But I think it's very interesting what lies number 2 and has for a number of years now, girls soccer. And then also what really raises awareness to me here is a lot of times we don't think a whole lot about cheerleading being a very significant cause for injury, but look at that rate. I think that's pretty interesting. So just real quick, moving on. I thought it'd be kind of interesting to present to you athletic trainer and medical services data. Mission member schools with athletic training services, mission member schools without athletic training services. I go to a lot of national meetings that this is highly debated. A lot of people want to start requiring schools to have athletic trainers. Well, a couple different problems. One, availability. We have a lot more schools than we probably have certified athletic trainers. But where'd my numbers slide go? Numbers aren't on there. Hang on just a second, because I still want to report this to you. For some reason, that's not the updated PowerPoint. So real quick, 503 schools responding. Schools with athletic trainers at their practices, 138. Schools with athletic trainers at their contest, 346. And of course, those that practice and those that contest, those schools that have them at practice are the same schools, of course, that have them at contest. Schools with no athletic training services whatsoever, out of that 503 responding to the question, 157. And just real quick in closing, I shared with you what we want to start taking a look at as far as distribution of the survey by season instead of just once at the end of the school year, facilitated through our mission website. Please, administrators, know that you can add your athletic trainers and school nurses to your admin page, which allows us to send them email broadcasts related to sports medicine related topics. And as of now, that is all I have. I hope we didn't go too far over. Any questions? George? Or, sorry about that.
Any questions? All right, well, if you'd like to say thank you very much on behalf of the Missouri Brain Injury Association, we have a small gift of appreciation. Now we have box lunches out in the hallway. If you want to get a box lunch and bring it in here, we encourage it. And if you want, fill out your bingo form at the table during lunch. So we appreciate your help. Thank you.